Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington. And I'm a physical therapist and an integrated manual therapist or lifelong runner. And I've got some thoughts about healing. People sometimes they wonder why on my office building it says running injuries, sports injuries, chronic pain, and autoimmune. And I want to talk about that because the problem I see with people that the problem that people are dealing with when dealing with a chronic running injury, for example, or a chronic injury that's keeping them from being active. You know, they can't canoe, or they can't walk, or they can't walk their dog, or there's something going on that's limiting them in their life. The problem is not muscles, it's not joints. And I say that because a lot of physical therapists will not touch somebody. They'll just work on the muscles and joints with exercises and lots of stability exercises and lots of things looking at the balance in the body, and that's all good. But the problem I find is the muscles and the joints. That's not the root cause. So, you know, I see lots of clients who come to me after they've tried a lot of different things, a lot of really good physical therapy, very big sports medicine guys that and gals that do very good high-level closed kinetic chain exercises, and you know, there's all these plyometrics and all these drills, yet the person still has hip pain and they can't run, or knee pain and they can't run, or back pain and they can't do what they want to do. And the reason is the body's protecting them. And so when I think of autoimmune, what that means is the body is using their own immune system to attack itself. Now, why would a body attack itself? You know, when you think of all the autoimmune conditions, Sjogren's and ulcerative colitis and psoriatic arthritis and rheumatoid arthritis, and even when you consider diabetes or heart disease, why would the body break down like that? You know, why would it do that? And so, you know, what it's doing is it's protecting you. So the body in its wisdom somehow is attacking itself. Why would it do that? So one example is some runners. I've seen quite a few runners, some middle school and high school and college runners recently that have had hip and knee pain that has not resolved, lost whole seasons, been to really good physical therapy, athletic training, lots of exercises, they're strong, they can't run because of severe pain. And what we found in a few of those cases was their colon, literally the colon, the right side of the colon specifically for a few of these people, and it was leaking just a little bit. It's called leaky gut syndrome. You can look it up. It's a syndrome. It's a thing. And the body in its wisdom was clamping down to protect a leaky gut. Now, why would a gut start to leak? Well, one reason, there could be numerous reasons. One reason is gluten. And the body will see gluten as an enemy, and it'll start to send the immune system out to attack gluten. The problem is the gluten molecule looks a lot like bone and thyroid and nervous system, like spinal cord cells. So some people, it will also attack the joints. And then they got a problem that looks like a standard physical therapy problem, yet it's not responding to muscles and joint work. Some people, it'll attack the thyroid, and they start to get thyroid symptoms. Some people, attack the gut, and they get ulcerative colitis. Some people, it'll attack the spinal cord, and they start to get some neurological symptoms. So the key is to go find what the body's protecting you from. So with runners, sometimes there's an autoimmune connection. They're doing something to protect themselves. In my case, you know, I tell the story of having an 8-month problem of calf spasm. After running 70, 80, 90 miles a week for most of my adult life, for all of my adult life really, I wasn't able to run more than 5 minutes. And for 8 months, that's the way it went. Despite lots of physical therapy from my therapist in San Diego that were working for me, I had 3 different pairs of orthotics, I went to lots of practitioners, yet I couldn't run more than 5 minutes. All this work to my legs and pelvis and all of that lower leg stuff. One therapist found a problem in my heart, literally in my heart, and in the big aorta. Now, it wasn't a medical emergency, but it's what's called leaky vessel syndrome. There's a thing, you can look it up. And she did the 2-hour treatment to correct this. And then my body, in its wisdom, was no longer protecting this, which was tugging on the lower leg, which was causing the muscles in the calf to spasm. When that happened, 2 days later, I went and tested it. I went for a run and was able to run. So that you want to find why is the body doing it. And the autoimmune part of this whole situation is the body's attacking itself for a very specific reason. And it's kind of like if you have a fire, say a gas main breaks in your house and a spark happens and you've got a fire, there's going to be lots of firemen and police, and they're going to use axes and tear down the door, and they're going to flood the house with water and ruin lots of the house. They're trying to get the people out, because the most important thing is to get the people out alive. The collateral damage could be the house gets ruined. The collateral damage could be water damage and the door's broken down and the frame of the house is disrupted, but the people are okay. So what happens with the body when we think of this autoimmune piece is we go and try to take away the firemen and take away the police and say, no, we got to stop putting all this water. It's ruining the house. We got to stop tearing down doors. Let's try to fix the door. We tell the firemen to go away because we don't like the way what's happening to the rest of the house. You can think of the house as the bones and joints. So you're trying to fix the bones and joints and muscles, but that's just collateral damage for something else that's more important. So this is a big component that I want to get out to the world, because you can heal. You can get your health back. You can get your life back. And if you've been trying a lot of different things that just aren't working, it makes sense. You got tight muscles, let's stretch them. Let's massage them. You got joints that are out of alignment, let's pop them, let's manipulate them, let's work on them. You got muscle imbalances, let's strengthen it and do all this strength work and plyometrics. But if it's not working, there's a reason. And so that's my job. I'm here to help heal ourselves, heal my clients, heal the world, and get runners back to running and active people back to being active. And I'm here to tell you, if it can happen, it can unhappen. It's been my experience for many years, with over 40 years of doing physical therapy. So if you're dealing with a problem, if you're dealing with a pain, a condition, something that's just not getting better, not really, if it keeps coming back, like it's a hip here, and then it's a knee there, and then later on it's the Achilles here, you're playing whack-a-mole. You're going after this problem and that problem and this problem, but it's not the problem. Where's the cause of the problem? So that's what I do. Reach out to me. My name is Ralph Havens. I'm a physical therapist dedicated to helping people get their health and life back. I'm here in Bellingham, Washington, and over Zoom worldwide. So my website, ralphhavens.com. Reach out to me. I've got a blog on that with lots of information about running. Go to the schedule some time with me. Call me 360-599-2217. And let's get out there and heal you up and get yourself back to doing what you want to do in life. All right. Talk to you all soon.